clothes, give me love, and give me shelter, shelter. Simple life, it's all we want to live. Give me food, give me clothes, give me love, and give me shelter, shelter. Yeah.
Good morning, good evening, or good afternoon, I should say, beautiful people of Liberia and across the world tuning in. Welcome to the very first episode of our new health talk series brought to you by the We Too Are Liberians movement platform. I'm your host, Ayiti Williams, and I'm deeply honored to sit down with a visionary healthcare leader, someone whose work is transforming lives in our community. Mr. Ansu Molley, a family nurse practitioner and the founder of Molley Family Healthcare and Wellness Center. Welcome to the show, Mr. Ansu.
Thank you. Charles, I really do appreciate you having me on once more. It's an opportunity and an honor to be here. Thank you.
So welcome again. This series is dedicated to educating young and old alike on the causes, effects, and prevention of diseases, with a deep focus on insight of our future nurses and healthcare providers. And tonight, we begin with a condition that affects millions, but is often misunderstood: blood pressure and associated disorders. So for the benefit of our viewers who are tuning in today, again, this is the We Too Are Liberians movement platform. We say the platform that speaks to and for the masses. We're certainly not in the business of manufacturing players, pimps, and hustlers. We're in the business of changing and revolutionizing the thought process of our people, not only in Liberia, but even around the world. So again, for our listening viewers and those that are tuning in, Mr. Ansu, I want us to share this show. So if you have a phone, please go ahead now. The show is being streamed on Facebook as well as YouTube. So we're going to go right ahead to try to share the show. So I'm going to go here on YouTube where we stream the show live. See if we can share the show with as many people as possible. I'm sorry here. I see that. Let's go ahead and share the show. There you go. So I'm sharing it now on Facebook. I'll go ahead and also share the show on the show is being shared on Facebook. Let's see if we can share the show on WhatsApp and other social media outlets platform. Let me see if I can share the show with as many people as possible. Okay, so there you go. All right. So Mr. Ansu, I know this is what you do for a living, and it's good to have you. The show is actually, I'll say, divided into segments for the benefit of our viewers. The show has 5 segments. Our first segment is named Understanding the Basics. Second segment, I struggle with this particular terminology, but I'm going to go ahead and pronounce it anyway. Pathophysiological or pathophysiology and complications. Excuse me. The third segment would be prevention and lifestyle. Fourth segment, management and treatment. The fifth segment, community and future nurses. So I will say again, this is what you do for a living, and we are looking forward to just hearing you giving us your best here tonight as to this particular topic. Thank you again for coming. Would you like to just say something just before we begin the show?
I'm definitely glad to be here, Charles. I'm very passionate about this topic, especially blood pressure. It's definitely misunderstood by a lot of people when it comes to talking about blood pressure. There are different diverse areas we can go into here. And it's important that we start by talking about the anatomy. I know you want to get into that. That is what causes blood pressure problems. The etymology of that, about that, the heart. Let's talk about the heart and how the heart works. Okay. So If that includes your first segment, then I'd like to get straightly into that. I'm very passionate about this topic. I love the heart. It's one of the biggest organs that we have in the human body. And just like most of the other systems, the heart is also very important. I'm not going to say the misconception that one system is more important than the other system is not true. Every system in the body, just like the heart, is important because they all are interconnected. They work together. Okay, so let's look at the anatomy of the heart, if you would. So the heart is
what we're going to do, we'll get to that. I'll definitely allow you to continue, but I have put some questions together, so I'll allow you to give us a synopsis of what you want to talk about. Then we'll go ahead with the questions, and you'll respond to that.
Well, I'll follow your lead. Let's follow your lead.
Okay. Thank you very much, Mr. Molley. So we'll go right ahead and start. To set the stage for tonight, can you explain what blood pressure is in simple terms and why it's such a crucial indicator of health?
Well, blood pressure is very important. What blood pressure actually is, like I was initially saying, most people have it misconstrued. It's a resistance thing. It's how much our heart's ability to perfuse every major organ in the body, every single organ in the body, from the heart itself to your lungs and your kidneys, and every other single organ in the body they're moving, they're alive because they get oxygenated blood from the heart. So without perfusing these organs with oxygenated blood, most of us won't be alive. So if the heart ability is the heart's responsibility to perfuse every organ, including your eyes, your lungs, your kidneys, your appendix, and every single organ. So they need oxygenated blood to stay alive, including your brain as well. So blood pressure is the blood pressure responsibility to take that through, to make that happen, I would say.
Thank you. That'll take us to our next question. Many of our listeners have heard of high blood pressure or hypertension. From a nursing perspective, can you walk us through the pathophysiology or physiology? And let me say it that way.
Pathophysiology.
Physiology. There you go. What's actually happening inside the body?
Well, let's talk about the term itself, pathophysiology. Pathology is medicine, it's the study of diseases, and physiology is the connection of the study of diseases relating to normal function of the human body. So pathophysiology itself, in other words, is just the study of the various disease process affecting the normal function of the human body. So we're studying the disease functions and how they affect the normal function of you and I.
Wow. That was straight up. So then let's talk numbers, right? Let's talk numbers, like I said earlier. What are the current clinical guidelines for blood pressure categories? Normal, elevated, stage one, and stage 2 hypertension. And how are these thresholds determined?
Well, there's a joint commission in the United States that set these parameters every year. Sometimes they will go every 2 to 3 years. But normal blood pressure generally is defined as a blood pressure below 120/80. Before getting into the various stages, I should kind of break down what systolic and diastolic blood pressure are. The top number in your blood pressure is what we call systolic blood pressure, and the bottom number is your diastolic blood pressure. What do those mean? So systolic blood pressure is the heart's ability. Every time the human heart beats, you hear 2 sounds normally. There could be a third sound or a fourth sound. So the first sound you hear, boom, that's your systolic blood pressure. It's a function of how much blood is leaving the heart and actually being perfusing all your organs around your body. And that happens in microseconds, millions and billions of times a day. And the bottom number, which is your diastolic blood pressure, is how much blood is returning to the heart after the systolic blood, the heart perfuses with the diastolic, and the blood returns back through your inferior vena cava, like the veins in your lower extremities, like your legs and your thighs, and return back to the bottom of the heart. So there are 4 chambers of the heart, okay? So the lower chambers are called the ventricles. So the blood returns to the ventricle after the systolic blood pressure perfuses. The blood leaves the right and left atrium and goes into your lungs, acquires oxygen, and then perfuses all your organs. So blood does not just leave the heart and travels to the various organs to perfuse them. It needs oxygen. So all the blood coming, every time you hear that boom, that's systolic blood, that's heart sound. It takes blood to the lungs, perfuses all your organs in microseconds, and then returns back to the lower extremity, via the lower extremity, and back to the bottom of the heart. And that process repeats itself millions and millions and perhaps billions of times a day.
Mr. Molley, I want to thank you very much for eloquently, just espousing what's the basics of this particular, illness is all about. Now that'll take us to our next segment, which is segment 2. And before the end of this interview, I want to make sure that I master the pronunciation of this particular term and its complication. That's the pathophysiology. Am I getting it right now?
Yeah, pathophysiology, definitely.
100%. So that pathophysiology and complications is our next segment. So in your clinical experience, Mr. Molley, how does chronic hypertension affect major organs over time, especially the heart, kidneys, brain, and eyes?
Okay, so before touching on that, I want to start digress here just very quickly on the stages of the blood pressure. So I was initially saying that the JNC, the Joint Commission, sets these parameters every year, or sometimes perhaps every 2 or 3 years. It's a commission that meets and set the parameters based on various research as to what should be considered normal blood pressure and abnormal blood pressure. So any blood pressure over 120, around less than 120 over 80 is considered normal, okay? And then elevated blood pressure is anything between 120 to 129 systolic, and then over 80 to 89. And then stage 1 hypertension, we call it, will be anything between 130 to 139 systolic. I'm sorry, guys, 130 to 139 systolic, and over 80 to 89. And then stage 2 would be 140 to 149 over 90 to 99. But anything over 140 or 180, I should say, systolic, over 90 plus will be considered hypertensive crisis. That requires an immediate intervention by your doctor. Okay, so let's go back to the pathophysiologist. In studying the diseases, the disease process, and how it affects the various parts of the various organs in the body, there are several disorders that originate from just the blood pressure. I want to break it down into segments. The most common blood pressure problem we have today is hypertension, which means high blood pressure. There could also be hypotension, which means low blood pressure. Conversely, both terminologies mean different things. They could cause different disease processes relating to the cardiovascular system in particular and other systems in the body. All right. So hypertension in particular would cause originates. Let's talk about what causes them. Okay. Number 1, stress in the body. That's the top determined cause of hypertension. So any action that elicits a flight or fight response in the body causes stress. It means you're worried. You're thinking about what you're going to do to alleviate that problem. It could be like a family member stressing you. It could be like your job stressing you. Whatever it is, elicits a flight or fight response. So there are chemicals in our bloodstream that causes us, from the pathophysiological perspective, cortisone, there are several hormones like cortisone, which is called the stress hormone. There are also catecholamines, which are also stress hormones. What happens is the levels of those hormones increases in our bloodstream as we become stressed. And what happens is when we become stressed, our brain doesn't get enough oxygen. How is that happening? Okay, so I want to break that down. The lumens of our veins, or the inside of the veins that run from our heart, does not become clogged over time as we age. Okay, when we are stressed out, these chemicals causes the inside of those veins to contract. When they contract, blood flow becomes very hard to put. They're forcing their way through because the inside of the veins is so tight. They are so tight. That's what we call contraction. Dilation is when the veins are open. Normally, when you're not stressed out, the veins are dilated, so blood can flow easily. But when they're contracted over time because of stress, number one, because of all these hormones, these stress hormones like cortisol, like norepinephrine and epinephrine that have been released, they block those veins over time. That automatically increases our blood pressure. Blood pressure, the misunderstanding thing, the misunderstood thing here about blood pressure is that it's not the actual amount of blood flowing through the vein. It's how much force. I mean, is the veins open or are the veins open or not? Are they dilated or just closed up? So the more contracted the veins are, the higher your blood pressure. The more open and dilated the veins are, the lower your blood pressure or normal they will become. So the second thing that causes blood pressure problem, I would say, is family history. Okay, most of us have relatives and family members that have a history of blood pressure problems. They're not directly; those are indirect determinants of like hypertension, I would say, or high blood pressure, for that matter. Over time, family members, the way we live around our family members, the things we acquire over time, it's not a direct relationship or correlation between our blood pressure and our family members. But over time, once we're born in a family, we turn to acquire some of those characteristics. The foods that we eat over time have the propensity to increase our blood pressure because different ethnic groups eat different foods. Caucasians, Chinese, Caucasians and Asians are prone to much lower blood pressure than most African Americans like you and myself. What's happening over time is as we eat most of these foods, like for instance, fatty food that have very high fat contents, what happens is the veins or the lumens of the veins that run from our heart become blocked over time much faster. But generally, every single person, as we age over time, we acquire some kind of blood pressure problems. Hence, we have to watch the foods that we eat. In addition to stress, the foods that we eat, family history, and all that play an important role in increasing or decreasing our blood pressure over time.
Thank you very much, Mr. Ansu. This is Paul Pack. I'm really excited. Call you Mr. Molley, call you Ansu at some point. I'm pretty sure you don't have any problem with it. And because the essence of this show actually is to the We Too movement. Our primary mission here is to educate, cultivate, and empower the socially and morally conscious youth, who is sensitive to the wrongs and sufferings of society, and to have you come just to give us, to teach and to, espouse what you've learned. I think it speaks to the core, because the real truth is it takes your education from theory into practice. Not only have you learned this, you're practicing and you're espousing and teaching, here. So I'm really excited to have you here. And I want you to bear with me, because there will be times where I will struggle with these medical terms. So the essence of the show also is to give us clarity. So you have prospective nurses, CNAs, let's say RN, maybe BSN. You may also have practitioner nurses who might be watching this as well. So that'll take us to our next question. From a nursing pathophysiology lens, can you discuss the RAAS, which is RAAS, which is ROS, I'll call it the renin angiotensin aldosterone system and its role in blood pressure regulation.
Well, angiotensins or ACE inhibitors, if we say, we're going to, I think you're moving into the more like of the management side of the disorder. Then there are different kinds of, I'm not sure if you wanted to get into the management side of it right now, but it's a system, it's a check and balance system. Okay, the body has a remarkable ability to remind itself. For instance, the brain sends messages if your blood pressure is off, like you start to feel symptoms of a lot of different symptoms like shortness of breath, like back pain, vision problems, and all that are signs that, okay, your blood pressure might be really high. But the RAS and ACE inhibitors are medicines basically that help open up these veins and help dilate the veins so that blood pressure can flow more freely. But it's more like a check and balance system in general as far as RAS is concerned.
Thank you again. That'll take us to our next question. And we're still on our second segment here. How does secondary hypertension differ from primary, and what are some red flags that nurses and patients should be aware of?
Red flags of second primary hypertension is basically, okay, you have a direct link from, like, it could be family, it could be the foods that you eat over time, like acquiring blood pressure based on something else that directly related to you yourself, not family. Secondary hypertension is more like acquiring blood pressure because of some other cause in the body. Maybe you have a kidney problem that ultimately result into your blood pressure getting high. That's more secondary. And how these are managed, if you manage, it's more from a preventative place. If you manage your primary hypertension, it's most likely that most of the other systems that will cause in the secondary problems will be alleviated because the primary hypertension is already addressed. So how do we get into that? I'm not sure if you're ready to get into so I'm sorry, your questions are a little back and forth, so I don't want to answer the questions because I anticipate that later on. But okay, if we address the primary side of hypertension, most of the secondary hypertension issues would be addressed as well before. So we have to address the primary hypertension. We have to start doing what? Eating right, diet and exercise, and a bunch of other things, which we'll get into later on.
Thank you. And because of the benefit of brevity, that is the sake of time. You know, we don't have time; is so scarce. That's why I didn't want to throw too many questions at you. And I know you've promised that you'll always come to be a recurring guest here and to offer us this, not only for the platform, but for the general public as well. So now we'll move on to our third segment, which is prevention and lifestyle. This is the question that I have for you, the very first question for this segment. Lifestyle modification is often the first line of defense. In your practice, what are the most impactful lifestyle changes you've seen that helped patients lower their blood pressure naturally?
The first one we kind of touched on briefly. I would say reducing stress is number one for me. Trying to stay away from stressful situations. It could be walking away from anything that stresses you out. I mean, definitely will help impact not just your blood pressure, not just your cardiovascular system, but a lot of other systems. You could prevent multi-system problems in your body by just staying totally away from anything that stresses you out. So that's the first line I would say. I usually outline stress as my number one preventative lifestyle modification strategy before getting to diet and exercise. Okay, so I would say stress reducing, alleviating if you can, or reducing stress should be the number one thing. Stay away from anything that stresses you out because over time, your heart is going to suffer. And the second thing I would say is diet and exercise as far as our lifestyle modification. And I like to touch on exercise in particular. I mean, nowadays we see everybody going to the gym, everybody's working out so hard. But there are studies that actually show that most of our people out there that have high blood pressure, I would say, or hypertension situations, should now focus on walking. Just walking steadily is the most effective way, I would say, method of exercise right now. Why it's important that people still do what they have to do as far as exercise, lifting weights and running and all that, but walking has shown to be the most effective way. So you could be 50, 60, 70 years old, just walking continuously and steadily. I mean, you keep your heart moving. The big thing here is like to just make sure that your heart is perfusing blood continuously and steadily, and blood is not just sitting in the heart. That could also lead to other problems like cardiomyopathy and other big problems that could cause serious multi-system issues. But I'll encourage walking, just basic walking continuously, steadily, helps solve some of that problem as far as exercise is concerned. So stress, number one, reducing stress, number one, diet and exercise, number two. But I'll say even more than diet, I would like to emphasize on exercise. So diet, alleviating obesity and morbid obesity is definitely a huge way of alleviating some of the blood pressure problems that most of us have. So I'll encourage you, diet and exercise, stress, number one, exercise in the form of steady walking, number two, and just maintaining. Steve Jobs once said, there's a billionaire that passed away years ago. He said that if you don't eat your food as your medicines, you'll one day eat your medicines as your food.
Wow.
No. So let's all focus on that. Let's try to eat right, do our best to eat right, walk as much as we can steadily, and just stay away from stress.
Mr. Ansu, you nailed it all 100%, man. Appreciate you coming to share with us on this particular, program, your thoughts. I mean, it's just, I think we need this more often on this Blue app, social media. Our people need it more often. So now this will take us to our next question, which is, I want us to debunk this particular myth because when I did my research, many believe hypertension only affects older adults. What trends are you seeing among younger populations in Liberia and among the diaspora?
Well, I think it's a myth that hypertension only affects older adults. Why the natural trend is that as we age over time, most of us, if not all of us, would develop some form of hypertensive disease over time. But the trend is that we're also seeing younger generations in their 20s, 30s, and even 40s having serious blood pressure or hypertensive issues. What happens is that I mentioned the whole race factor earlier. Different ethnic groups acquire different levels of hypertensive issues. So if you're an African American, or some would say a Black person versus a Caucasian, or for lack of a better word here, a white person, I don't like to use the colored words here, you're eating different foods throughout your life. As you eat these foods over time, what happens is they go into your bloodstream, they are metabolized. And the analogy I usually use is that if you take a plastic bottle and pour grease or oil into that plastic bottle over time, every day, what happens? The grease or oil will adhere to the walls of that bottle over time. Okay. And if you keep pouring the grease or oil in that bottle over and over, you find out later on, you realize that the inside of that bottle is going to get completely clogged. Once the walls of that bottle becomes completely blocked with grease or oil, and the middle part of it is just going to get completely clogged. Imagine that's how your veins are in your body. As we eat these foods over time, what happens is that they go into the bloodstream, and as they flow through our bloodstream, they're rubbing some of those oils and foods that we're eating, fatty foods that we're eating over time, are rubbing inside on the walls of those veins. In the inside, we call the lumen of your veins. And over years and years, as they accumulate over time, they close up those veins from the heart gradually. And for blood to flow through, it becomes harder and harder. That's what puts your blood pressure up. So let's get back here to younger people. So if you're an African American, or if you were, say, a Black person, you're eating all these foods and not watching what you eat over time, you're experiencing hypertension, or the lumens of your veins are closing up at a faster rate relative to somebody who's 60 or 70 or 80 years old. So it's still affecting these the younger generation. So to answer your question, is made because I've seen younger people have kidney failures and go into like other forms and have brain issues and other multi-system issues over time because they're not watching what we eat and what goes in our body. And the other thing is drinking excess alcohol over and over. Again, is one thing that contributes to like causing high levels of cholesterol in our body that in turn accelerate the closure of these veins in our body that run from our heart.
Perfect. Yeah, and this is no mistake at all having you tonight. And so for those of you who have tuned in again, this is the We Too Are Liberians Movement platform. Tonight we have in studio live the one and only Mr. Molley, who's a family practitioner nurse or family nurse practitioner. Our topic for tonight is blood pressure and blood pressure, and as you can see on screen, we have it here. It's Health Talk series brought to you by the We Too Are Liberians Movement platform. Again, our topic for tonight: blood pressure and associated disorder. Mr. Ansu, I struggle with that terminology, but I'm going to try the pathophysiology prevention.
There we go. Yes,
right. That's it. Right. So then, let's dive a little bit more deeper in because I know we've talked about the complication, but now what we want to talk about now, we're talking about prevention and lifestyle. And I just asked you this one question about the myth, and you actually went ahead and you clarified that. But can you talk about the DASH, D-A-S-H? That was something that I also researched. The DASH diet and how dietary changes play a role in managing. I know you kind of touched on that a little bit, but how does it play? The dietary changes play a role in managing hypertension, particularly in African communities with high sodium traditional meals.
Alleviating the body. Sodium in itself, just like all the other nutrients, what I encourage my patients, I'll start by saying what I encourage my patients to do is to basically continue to eat the same foods they've eaten their whole life. A good clinician should not tell you, oh, stop eating this food or eating that food. Everything should be done in moderation, okay? Your body needs sodium. For instance, sodium levels are 135 to 145. Anything between there, anything that goes under that level or over that level will cause the same problems. Sodium is one of those electrolytes that help with the connectivity of the generators of the heart. They help the heart work better. So eat the same food, but just decrease the portions. And as we age over time, what I also add is that, we can't continue to eat. If you're eating 5 bowls of rice a day when you're 20 years old, your rate of metabolism is higher at that age. You cannot be 60 and 70 years old and eating the same amount of food because your body loses its ability to metabolize carbohydrates, for instance, faster than when you were 20. So definitely, I would say to everybody here, eat the same foods, but cut back significantly the portions as we age over time, because age is a big determinant in helping us increase or decrease our blood pressure. If we keep eating the same foods, the veins are going to get clogged faster. You can't keep eating the same fatty foods for like 15, 20, 30, 40 years. In as much as that, there are other organs that are connected to the heart, like your pancreas, for instance. Carbohydrates is one of those food groups that we definitely need to cut back on, not just the electrolytes like sodium, magnesium, and others. We have to watch the carbohydrate, because over time, hence most people, we down the line we'll be talking about type 2 diabetes over time. But those are one of the things that eating excess carbs that can cause type 2 diabetes, because your pancreas is now organ somewhere around the upper right part of your stomach, your abdomen, I should say, that produces insulin naturally. We're not talking about diabetes here, but as we age over time, naturally, that organ loses its ability to produce insulin. So all the excess carbohydrates we're eating, all the extra electrolytes that we're consuming over time, our body does not produce natural insulin. So what happens is that they just sit in our body, they they cause an increase in obesity over time. And obesity, besides that, the levels of carbohydrates or hyperlipidemia or fat increases in our body, not just the fat problem, but we'll also run into problems of our veins getting clogged over time, our blood pressure going up. We going into disorders, heart disorders, which we'll touch on later on, like heart failure, cardiomegaly, cardiomyopathy, and a bunch of other heart disorders. So just maintaining moderation in every single electrolyte. And the big thing here also I want to stress on is drinking as much water as possible instead of fruit juices and other juices that lined with like sugar, like artificial sugars and other food sweeteners.
Yo, man, Mr. Molley seemed like he was born for this. This was take us to our next segment, which is segment 4. For those of you who are tuning in, again, you're watching the We Too Liberians Movement platform. This is what we do. This is our health talk. We're here with Mr. Ansu Molley, who's a family practitioner, a family nurse practitioner. This fourth segment is actually titled Management and Treatment. So now, this is what we're going to do here. This question, and I'm pretty sure you'll fire back here in detail. Now, pharmacological intervention, let me say it that way, is sometimes necessary. What are the main classes of antihypertensive medication, and how do they work directly or differently?
Well, that's a very important question. Before getting to the pharmacotherapeutics, I will term that, we touched on a lot of other management strategies already, like diet and exercise, reducing stress. But before, I will add that there are different kinds of medications or hypertensive agents that work better for different ethnic groups. Okay. One of the top medicines or top antihypertensive for African Americans are called the calcium channel blockers. Those are medicines that include the amlodipine, which is the top medicine in that group. You have verapamil, nifedipine, and other medicines. What those are, the way the mechanism of action works as such that they infuse calcium into the bloodstream, turn to like dilate or open up those veins so blood can flow through easily and thereby decreasing the blood pressure. And then conversely, with the top medicine that work better for Caucasians and Asians and other ethnic groups is called the ACE inhibitors. Those are the class of medicines. Most of them end with PRIL at the end, like lisinopril, ramipril, and other medicines. So you can group them as such that any medicines that end with PRIN at the end is an antihypertensive that works better for certain ethnic groups like the Asians and like Caucasians. Nevertheless, I should also add that a combination of both of these medicines, like a calcium channel blocker and an ACE inhibitor, is the most effective management, pharmacotherapeutic management medications to put together. If you combine an ACE inhibitor with a calcium channel blocker, you have a better effect. Nevertheless, you're cautioned to not use a calcium channel blocker because of some of the side effects. Okay, the biggest side effects for the ACE inhibitors, for instance, would be angioedema, or swelling of the eyes, or facial swelling. Whereas they're very important and help directly impact blood pressure by opening up the veins, you're cautioned that if you experience any side effects like angioedema, swelling of the face, swelling of the lips, that medicine should be stopped. And if you're on a medicine like an ACE inhibitor, like lisinopril, your kidneys need to be monitored. You have to do blood work like every 2 to 3 months. It depends on your doctor. Whereas the side effects for calcium channel blocker, which is one of the top medicines, pharmacotherapeutic for African Americans, this basic side effects is just pedal edema, or like swelling of the ankles. But then I still use that medicine. You can go up the highest dose you can put a patient on is 10 milligrams, for instance. If a patient starts to experience some side effects in like ankle swelling or something, I'm not taking a patient off that medicine, because it's the most effective blood pressure medicine. The JNC stressed that you can combine 2, 3, 4, or even 5 different blood pressure medicines if management strategy is not effective for one blood pressure medicine. I'll go up a second blood pressure, or even a third or fourth or fifth. Okay, depending on where the patient is. If you're in hypertensive crisis, obviously I've seen patients, I've prescribed medicines, antihypertensives, for patients that have, like, for instance, if your blood pressure is over 180, you're definitely going to be on more than one blood pressure medicine. So there are also other classes of blood pressure medicine that work differently, like the diuretics, we'll call them. Like, the way they work is a lot different from the ACE inhibitors and the calcium channel blockers. The diuretics actually help pull fluid away from your heart, your entire body, so that your veins can dilate over time, so blood pressure can go down. So they work a little differently from the ACE inhibitors and the calcium channel blocker that pull in fluids. So if you're on a medicine like a diuretic, like Lasix, or we call furosemide, or even hydrochlorothiazide, which is commonly used today as well, on like you have to, if you're on those medicines, you have to be careful when you're taking it. You don't want to take a diuretic late in the day, or if you have an appointment to go out to see family or your doctor, because you are going to be going to the bathroom a lot, because you're using the bathroom so often, because that blood pressure medicine is designed to pull fluids out of your body. So I wouldn't be taking a diuretic, even if it were prescribed for me. If I have to go out to an appointment, I will wait until I come back. And I encourage most patients to take a diuretic early in the morning. There are other classes like the beta blockers. Those are the medicines that end in LOL, for instance, metoprolol, propranolol, labetalol. Those have a direct impact. They're not as effective as the ACE inhibitors, calcium channel blockers, or even some of those cardiac glycosides, because they're not as effective, because they help with the pumping action. They address issues of the pump of the heart, as opposed to the lumens or the veins in the heart. So whereas they help decrease blood pressure, but they're not as effective. I think the effectiveness will be more or less like 5-10%, whereas calcium channel blockers and ACE inhibitors, a combination of those two, would directly drop the blood pressure significantly. Metoprolol is only seen as something now like a fourth-class antihypertensive that directly work in with the pumping action of the heart. So they use more for arrhythmias and like other heart issues than blood pressure.
Well, you're hearing from Mr. Molley, again, the family nurse practitioner. He's here just sharing with us his thought on and giving us information. This is more like a workshop. I mean, this is really good for those who are aspiring to be nurses and things of that nature, and even for the general populace. Like we said, this is free education, so take advantage of this. Encourage the show has been streamed on Facebook, on YouTube. Eventually we'll have it out there and for your view. So now let's go to our next question here. We have about I'll say somewhere around 10:47 p.m. I think we started a little after 10 o'clock. So we're going to try to exhaust all of the questions that we have. I think we have about 4 or 5 more questions, and then we'll be trying to draw the curtain here. So, Mr. Molley, how do nurses play a role in medication adherence, patient education, and long-term management of hypertensive patients?
Well, patients that are generally hospitalized depend on nurses, so not nurses to not only administer their medicines, but to teach them as to how these medicines actually work. Okay, to help them adhere to that. During the discharge process, you have nurses directly involved with patients, going over paperwork as to when and how to take these medicines. All right, and even after they go home, we have organizations and agencies now like directly involved with patients, especially elderly patients and patients that are not non-compliant with some of their medicines. There's not a whole lot you can do with an adult who's not going to take his medicine. That means ultimately a matter of choice. But nurses they're definitely involved with that process, especially I would say top and foremost during the discharge process from hospitals. Now you have most of these private practices like mine involved with like electronic health record that actually print out your medication list and actually gives you print out educational tools for you to go over and present that with you during your after your hospital visit or after your medical or your doctor's visit. So you have all these tools out there, and the nurses are at the forefront reviewing that with the patients before they leave the hospitals or even the practices.
Thank you very much. This is Power Pack. No regrets. That'll take us to our next question. What advice would you give to young nurses who want to become more involved in chronic disease management, especially in under-resourced areas?
Well, I would say we have to continue to give back. We have to reach out as much as you can. For those that work in the hospital and even out of the hospital, we have to, personally, I go out in the community. I'm in Chester and other places running little clinics on the streets every now and then. You know, we have to, the big thing is education here. We have to be willing to go out there and educate people, set up these little clinics to the best of our ability if we have the time. But without the education, most of us, not just the young or the old, but even all of us, if we're not educating people on how the disease process, especially blood pressure issues, and where they come from and how we acquire it. Not everyone has the basic knowledge about the kind of foods and what it does to the body. Now, what obesity does to the body, what stress does to the body. So all these are educational pieces that we can throw out there every chance. You could start with your own family at home by just explaining to them. It starts by going to the grocery store, supermarkets, and just bringing the right foods home. Not everybody can afford like all the healthy choices out there, but at the end of the day, it comes down to choice. If we're not educating people about the various food groups and what it will do to the inside of your body, then we're not helping as much as we can. So I encourage everyone, especially not just nurses, you yourself, Ayiti, I encourage you to educate as much as possible. It starts by just encouraging people to drink water instead of drinking juices and other drinks that are power packed with a lot of sugar in them. There's nothing wrong with having a little drink every now and then. Maybe I usually have a cup of coffee. It used to be every day for me. Now I'm down to once or twice a week. I'm eating a lot of not a whole lot of carbohydrate. I'm personally eating rice once a week or once or twice a week now. So those are little changes that you can push. You can help educate people to at least try to consider. If not, then not. If you can educate them, at least they might be able to listen to you and be like, okay, I'll follow your lifestyle. You can be the example. We have to practice what we preach, basically. If we are eating right, if people are seeing you eating right at home, they'll emulate your example. If they're seeing you drinking, if we're drinking alcohol every day, it's not going to help, guys. Because alcohol, for instance, is one of those drinks that is packed not just with sugar, But alcohol is has chemicals in it that basically vasoconstrict. They close up the veins and hold them tight, the veins that run from your heart. So I encourage all our buddies out there, all my friends, patients out there, drink alcohol moderately, cut back on fruit juices. Nurses, let's go out there and educate and help people understand the causes of high blood pressure and other hypertensive diseases.
Wow, thank you again. I mean, everything that you do, want to thank you. I mean, you're just what you do now aligns with our mission and our vision, and so with all that being said, information is just it's power packed, and you're unpacking a lot of stuff. I'm tempted to ask you more questions, but just because the fact that we don't have enough time, we will transition right into our fifth segment. And this segment is actually community and future nurses. My first question for this session, as we get close to the closing here, how can we, as a society, create better awareness about the silent dangers of high blood pressure? What role, that would be my second, this is more like a bonus question to that. What role do community-based nursing and outreach play?
Well, the misconception that we touched on earlier, that is hypertension or blood pressure problem only affect the older group or the elderly, is something that we have to dispel. We have community organizations and agencies out there now reaching out to our families and our patients out there and really helping them not just understand hypertension, but various disease processes and helping manage them from at home. Unfortunately, the resources that are tailored to managing patients out here in the West is not what everyone else has back in Africa and other places. So again, it brings us back to the same place. It's just education, education, and education. The next piece is matter of choice. I mean, as much as we want to educate people, but we have to be able to make better choices. And it's not just the nurse's responsibility. Families as well, I mean, have to be able to go out and be like, listen, I don't like how I'm living. I have to change something about my life. But overall, blood pressure is something that will affect every single one of us, whether we are Asians or Caucasians or Africans, is something that will affect us. So it's our role as a community to go out there and look out for one another and educate one another. We talked about stress management. We talked about diet and exercise. We talked about the medications. I mean, before it's a last resort, but let's go out there. Let's try to educate one another as to how to be. Let's talk about the problems. Like you see someone drinking excess alcohol. I mean, let's educate them about what that would do to the inside of their body or how it will affect their heart and other systems.
Thank you. Now we have, say, one more question before we get to our concluding question. And this question now is, what are some simple home monitoring? The question I'm asking may sound rhetorical because I know in some of your explanation, I think you touched a little bit on some of these things that I am going to be asking now at the conclusion of this interview. What are some simple home monitoring techniques or tools you would recommend to families wanting to take control of their health at home?
Well, the most basic thing is just making sure you have a blood pressure monitoring cuff. There are different kinds of them on the market now. They all work differently, but generally they are more effective. So it's better to have one than not have one. I personally prefer checking my patient's blood pressure manually. I like to listen to the beat of the heart and the veins and hear everything for myself. But I mean, if you have to be trained to know how to do that. So just having a basic blood pressure monitor with a battery and a cuff is something that I think each of us should have home, especially not just African Americans or Asians, but every single one, including Caucasians, should have a blood pressure machine. And another thing I would like to touch on, it's not necessary to check your blood pressure 5-10 times a day. One thing we didn't talk about here is a form of blood pressure called essential hypertension. Most people out there don't have a serious blood pressure problem. The problem is that we're actually not checking the right way, or we are doing something. Every single, whatever you do when you check your blood, if you're moving around, standing and walking around, has that propensity to increase your blood pressure, just even standing and moving or even talking when you check your blood pressure. I encourage people to like research, or nurses out there, community health nurses, to educate patients that it's not necessary, not only that it's not necessary to check 2, 3, 4 times if your blood pressure is high the first time. You get anxious, okay? You go into fight and flight, and your cortisol level goes up, and you start to realize that you're getting anxious. It's not a time to check your blood pressure. You have to be relaxed for anywhere between 5 and 10 minutes before getting an actually really accurate blood pressure reading. So a high or elevated blood pressure reading just once or twice in a day is not indicative of a true hypertension. It's what we term essential hypertension. It's episodic. It's only happening because there's something else you're doing that's not right. So in order to attain a good blood pressure reading, I encourage people, be relaxed for 5 to 10 minutes before you hit that start button. There's a higher chance that it might be more accurate as opposed to you just checking right after running from the gym or coming home. That's not the time to check your blood pressure. So you might not have a serious blood pressure problem. Like I said, it might just be what we term essential hypertension, high blood pressure that's related to something uncomfortable or something that causes anxiety.
Thank you. Also, finally, Mr. Molley, before I even ask you this final question, again, to all of our viewers, you know, this show should have been held last Thursday, but because Mr. Molley actually had a trip outside the country, we could not. We had to cancel the show. And I went ahead and I was trying to get someone to proxy on his behalf. He was actually making his way back to the States. And when I reached out to him, he said, "No doubt, I'll be there. Just don't even worry about it. I'm ready." And so he came in, he flew in tonight. He runs his own practice there in Seacan, Pennsylvania. You should check him out. I mean, he speaks for himself. You know, one thing as I conclude here, Ralph Waldo Emerson once said back in the lecture in 1871, he said, "If a man can write a better book, preach a better sermon, or build a better mousetrap than his neighbor, even if he builds his house in the word is going to make a beaten path to his door. It cannot be a highway." Dr. King concluded in one of his convocation speeches. He said, "Be a pathway." And Mr. Molley, I want to extend to you high commendation, because all you have done here tonight is you have exhibited that what you've learned to the best of your ability. I think you've been called to do this. So, I want to encourage you to continue this good work, and thank you for coming tonight to share with us, on this time and space, just to give us words of insight and to educate us. We appreciate you. Our final question now to you, Mr. Molley. What message would you like to leave for the next generation of nurses and healthcare providers, those watching tonight who dream of making a difference like you have?
Well, I do believe that we have a lot of really brilliant and successful nurses out there, Liberian nurses in particular. I would encourage some of my colleagues to come on the show and share what they are. Each of us are versed and proficient in certain areas. Why my area might be maybe cardiology, or I actually like talking about babies and the OB process. There might be another nurse that's versed and very proficient in pulmonology, or even the GI system. So I encourage nurses out there, let's educate as much as we can. Let's be bold and coming out here. If we are very, very strong in a particular area, I encourage all my colleagues to come out there. Let's get together. I mean, we're all Liberians, It's time for us to put our minds together, help out people as much as can. Just educating people is a big deal. I think Let's not just sit back and watch and fold our hands. I encourage all of you to come out here and share as much as you like to. So as I did tell Mr. Williams here, over the next couple of weeks, we will be discussing a lot of other disease processes. Since we've started with the heart or the cardiovascular system, we'll continue with this system. We'll choose another disorder and try to break it down as much as we can, so that our people out there can understand these processes. We can go out there and educate them as much as possible. So hopefully next week we'll choose another topic. It might be heart failure, or I'm not sure, we'll come up with something. Tonight we talk a lot more about high blood pressure, specifically hypertension. We never touch on hypertension. So hopefully we'll be touching on some of the the disorders that arise from hypertension and hypotension the following week, or even heart failure.
Again, we want to thank you, Mr. Molley, for tuning in tonight. For those of you who have just tuned in, again, this is the We Too are Liberians Movement platform, Health Talk. We're here with Mr. Molley. Topic for tonight: blood pressure and I guess associated disorder. I'm not even going to try to touch on that pathophysiology.
Pathophysiology, the disease process, and how it affects the normal systems.
Exactly. Thank you very much for coming in tonight. Tonight's discussion was not just a health talk. It was a life lesson, from understanding the science behind blood pressure to learning how we can prevent it from claiming lives. Mr. Molley has given us knowledge that can save generations. To every young nurse, aspiring healthcare worker, or concerned parent out there, your learning journey starts now. Each step you take in understanding the body is a step toward healing and helping your community. We'll see you again in 2 weeks, or maybe next week, like he said, on our next installment in this incredible series. Until then, stay healthy, stay curious, and remember, knowledge is the best medicine. I have been your host, Ayiti Williams. This is the We Too are Liberians Movement platform. Thank you very much again for coming, Mr. Molley. You have a good and pleasant night, and I look forward to talking to you again. Have a good night.
Pleasure, thank you. Thanks for having me.
Thank you very much. I appreciate it.
Yep.
It was a great show.
Thanks for having me.
Have a good night, Ansu.
Bye.
Simple life. It's all we want to live. Give me food, give me clothes, give me love, and give me shelter.